A middle-aged patient sits in a doctor's office, stunned as the physician points to a scan showing severe arterial blockage. Despite faithfully taking prescribed medications, their condition has worsened. Your diet may be undoing the benefits of your medication, the doctor explains. Cardiovascular disease affects 1 in 3 Americans, and genetics alone don't explain this crisis. What we eat daily plays a critical role in arterial health. This silent progression often goes unnoticed until a major health event occurs. The camera pans over a typical American lunch, a fast food burger, fries, and a sugary soda. These foods are convenient but laden with hidden dangers. Processed meats, refined carbs, and sugary drinks dominate diets, contributing to arterial inflammation and plaque buildup. Studies show that daily consumption of such meals increases the risk of heart disease by 20%. The normalization of these foods masks their long-term health consequences, making them a silent threat to cardiovascular health. A factory conveyor belt rolls out packaged foods, while labels reveal high levels of sodium, trans fats, and refined sugars. These additives preserve shelf life but damage arteries by promoting inflammation and oxidative stress. For example, a single frozen pizza can contain over 1,500 milligrams of sodium, nearly the daily limit. Microscopic animations show how these ingredients cause arterial walls to thicken, reducing blood flow. The convenience of processed foods comes at a steep cost to heart health. A family dinner scene shows parents serving fried chicken and soda to their children, while an elderly grandparent takes heart medication nearby. Dietary habits are often passed down unknowingly, perpetuating cycles of poor health. Research indicates that children who grow up eating processed foods are 40% more likely to develop heart disease. The table symbolizes a legacy of nutritional choices that, if unbroken, will continue to compromise future generations. Health. Supermarket shelves are lined with products labeled low-fat or heart-healthy, but a closer look reveals high sugar content. For instance, flavored yogurt marketed as healthy can contain more sugar than a candy bar. Shoppers, especially seniors, are misled by clever packaging. Statistics show that 60% of consumers misinterpret these labels. The camera zooms in on a confused elderly shopper comparing 2 seemingly identical items, highlighting the need for critical label reading. A calendar flips through months, each page displaying images of unhealthy meals, frozen dinners, fast food, and sugary snacks. Over time, these small choices compound, leading to arterial damage. Research confirms that consistent poor diet contributes to 80% of preventable heart disease cases. The scene culminates in a sudden chest pain moment, transitioning to an ER. The message is clear. Daily dietary decisions are incremental steps toward or away from health. A busy hospital corridor illustrates the strain of preventable cardiovascular cases. On a screen, stats reveal cardiovascular disease causes 1 in 3 deaths in the U.S. Doctors are overwhelmed, with many patients unaware that diet is a modifiable risk factor. A cardiologist remarks, "Medications treat symptoms, but without dietary changes, we're just delaying the inevitable." The scene underscores the gap between medical intervention and lifestyle responsibility. An animated cross-section compares a clogged artery, filled with fatty deposits from processed foods, to a healthy one nourished by a Mediterranean diet. Foods high in trans fats and sugars oxidize LDL cholesterol, creating plaque. In contrast, whole foods like olive oil and nuts reduce inflammation. The science is unambiguous. Dietary choices directly impact arterial flexibility and blood pressure. A side-by-side plate comparison drives home the power of food as medicine. A refrigerator undergoes a makeover. Processed foods replaced with fresh vegetables, lean proteins, and whole grains. Simple swaps are highlighted: avocado for mayo, sparkling water for soda, baked sweet potatoes for fries. A voiceover notes, small changes can reduce cardiovascular risk by 30% in 6 months. The original patient returns for a follow-up, smiling at improved lab results. Proof that dietary shifts, however modest, yield measurable benefits. A community potluck showcases colorful salads, grilled fish, and children happily eating vegetables. Neighbors share recipes and success stories, breaking the cycle of poor dietary habits. A revised grocery receipt, free of processed items, symbolizes collective change. The narrator concludes, "Your plate is your most powerful prescription. Start today and inspire others to join you." The screen fades to a heart-healthy meal, with the tagline, "Food is medicine. Choose wisely."